Understanding sepsis, causes, signs, symptoms, and treatment. Sepsis is a life-threatening condition that arises when the body's response to infection causes widespread inflammation. This can lead to tissue damage, organ failure, and death if not promptly treated. Here's a detailed overview of sepsis, including its causes, signs, symptoms, and treatment options. Causes. Sepsis occurs as a complication of an infection, and it can be triggered by infections anywhere in the body. Common causes include bacterial infections, the most common cause, including infections of the lungs, pneumonia, urinary tract, abdomen, and bloodstream, bacteremia. Viral infections, such as the flu or COVID-19. Fungal infections, particularly in immunocompromised individuals. Parasitic infections, though less common, these can also lead to sepsis. Signs and symptoms. Sepsis symptoms can vary but often include early signs, fever or hypothermia, low body temperature, chills and shivering, rapid heartbeat, tachycardia, rapid breathing, tachypnea, confusion or disorientation, extreme pain or discomfort, clammy or sweaty skin, severe sepsis, difficulty breathing, low urine output, abnormal heart function, abdominal pain, significant decrease in platelet count, septic shock, severe drop in blood pressure that doesn't respond to fluid replacement. Signs of organ failure, such as kidney failure or difficulty breathing. Diagnosis. Diagnosing sepsis involves several steps: medical history and physical examination, assessing symptoms and potential sources of infection. Laboratory tests, blood tests, to identify infections, assess organ function, and measure markers of inflammation, e.g., white blood cell count, C-reactive protein. Cultures, blood, urine, wound, or respiratory cultures to identify the causative organism. Imaging studies, X-rays, CT scans, or ultrasounds to identify the source of infection. Treatment. Early and aggressive treatment is crucial for sepsis. Treatment strategies include antibiotics. Broad-spectrum antibiotics are administered as soon as possible, often before the specific pathogen is identified. Once the pathogen is known, targeted antibiotics are used. Intravenous fluids, to maintain blood pressure and organ perfusion. Vasopressors, medications to constrict blood vessels and raise blood pressure if fluids alone are insufficient. Oxygen therapy, to ensure adequate oxygen levels in the blood. Mechanical ventilation may be required in severe cases. Source control, identifying and treating the source of infection, such as draining an abscess or removing infected tissue. Supportive care, managing symptoms and supporting organ function, such as dialysis for kidney failure or medications to support heart function. Prognosis. The prognosis for sepsis varies depending on factors such as the patient's age, overall health, the speed of diagnosis and treatment, and the underlying cause of the infection. Early recognition and treatment are crucial for improving outcomes. Despite advances in care, sepsis can have a high mortality rate, particularly in severe cases or septic shock. Management and supportive care. Monitoring. Continuous monitoring of vital signs, organ function, and response to treatment. Rehabilitation. Post-sepsis syndrome is common, requiring physical, cognitive, and psychological rehabilitation. Follow-up care. Regular checkups to monitor recovery and manage any long-term effects of sepsis. Sepsis is a severe and potentially fatal condition triggered by the body's response to infection. Understanding the causes, recognizing the signs and symptoms, and seeking immediate treatment are critical for improving survival rates and outcomes. Preventive measures, such as timely treatment of infections and vaccinations, can help reduce the risk of developing sepsis.